Can I afford a health plan?
Can I?
Can I afford a health plan? Can I afford a health plan?
Because it matters how you're treated. Blue Cross Blue Shield of South Carolina and Blue Choice Health Plan will work with you to find a health plan that fits your budget and lifestyle. If you've ever considered buying a health plan, the sticker shock may have sent you running, but that may not be a problem for you anymore. You may be eligible for financial help that will lower your costs on a new health plan. So the only thing you'll have to choose is which health plan you want, and not whether or not to buy one. Let's start with that financial help. Let's say you want a new car. Problem is, you don't think you can afford the monthly payments. But what if someone else made the down payment for you? One big enough to drop your monthly payments to an amount you could actually handle. And to top it off, maybe this same person also gives you some gas cards or a free oil change every now and then. That's sort of what's happening with healthcare reform. If you make less than $46,000 a year, you could get financial help that could drastically lower your premium, which is your monthly payment, on a health insurance plan. But that's not all. You also could qualify for other lower costs associated with a health plan: your deductible, co-insurance, and co-payment. Let's take a quick detour here to talk about these things, in case you're not familiar with them. Your deductible is the amount of money you have to pay first before your insurance starts to help. Co-insurance is your share of your costs once your insurance starts to pay. For example, if your co-insurance is 40%, then you pay for 40% of your medical bill and your plan pays the remaining 60%. A co-payment is a fixed amount that you might pay for doctor's visits, like $25 for each visit. Keeping these terms straight might be a bit confusing right now, so here's the most important thing to remember. If you qualify for financial help, these amounts could be much lower for you, which means you will pay less money out of your own pocket when you have to go to the doctor or hospital. Got your attention? Let's keep going with our car example. Imagine walking into a car dealership and offering to buy a car, but the salesperson won't sell it to you because you had a wreck a few months ago. That used to be the case with health insurance. If you had a pre-existing condition, you couldn't get coverage or the cost of the plan would be higher, but not anymore. You can't be turned down for coverage, and if you get sick, your coverage won't be taken away from you. Like what you're hearing? Let's go a little further. So you've got some financial help to make the car more affordable, and you can buy any car you want from wherever you want. So how do you find the one that's right for you? You could drive around town and check all the car lots, but that would take a lot of time and gas. You could go online and search the web. But wouldn't it be great if you could line up all of your choices side by side before you made your final decision? Buying a health plan will be that easy. You can shop for a health plan online on something called an exchange or a marketplace. It's a place where you can easily compare all of the health plans on that exchange side by side to see which one is really right for you. You can use the marketplace to see exactly how much financial help you qualify for and what your actual costs will be on the plan you want. How easy is that? In South Carolina, Blue Cross Blue Shield of South Carolina and Blue Choice Health Plan will have their own private exchanges where you can shop exclusively for Blue plans. After all, wouldn't it be nice to apply that down payment or financial help to a top-of-the-line health plan from Blue? There's another type of exchange called the Health Insurance Marketplace. It's the exchange you've probably heard about in the news. While it's operated by the federal government, it will be available for people in South Carolina. So to recap, you may be eligible for financial help that can lower your premium rate or your other out-of-pocket costs. You can't be turned down for coverage, dropped from coverage, or charged more for coverage based on your health. Comparing and choosing a health plan will be easy. You can do it online and you can do it with Blue. If you want to learn more about how healthcare is changing and how healthcare reform affects you, be sure to watch the other videos in this series. And remember, when it comes to your health insurance, it's time to put yourself in the driver's seat and let Blue Cross Blue Shield of South Carolina and Blue Choice Health Plan be your guide.